Welcome to Care for PA's Monthly Minute. I'm Tim Oram, Director of Legislative Services for the Hospital and Health System Association of Pennsylvania. Over the past few months, I talked about two serious issues facing hospitals and healthcare in Pennsylvania: a state budget that cuts payments to hospitals, and important legal reforms to our state's medical liability system. I'm pleased to report that with your help, Pennsylvania has achieved long overdue common sense reforms to its medical liability system. After several months and many efforts by some to block these important reforms, the Fair Share Act was passed. Also known as Senate Bill 1131, the act ensures that defendants in a case are responsible only for their fair share of damages. The Care for PA family sent thousands of emails to lawmakers across the state, urging them to support this important piece of legislation. Lawmakers responded, and the bill was ultimately passed and signed into law by Governor Corbett. It's time to say thank you to those lawmakers now who supported the bill. Please take a moment to thank these lawmakers by going to the Take Action area of Care for PA and sending an email. Taking time to thank these folks for their support is often an overlooked advocacy tool, but it is very important. On to the state budget. In early March, Governor Corbett released a proposed state budget amidst a $4.2 billion state deficit. As expected, his proposed budget called for significant cuts in payments to hospitals that treat patients with Medicaid. After an intense advocacy campaign by Pennsylvania's hospital community, including 25,000 emails sent from the Care for PA family, the General Assembly restored many of these cuts. Pennsylvania hospital leaders were disappointed that there was not full restoration because these cuts are combined with another issue brewing in Washington. Pennsylvania's hospitals are at great risk. Congress and the President are focusing a great deal of attention on our nation's debt, which is nearing the legal limit of $14.3 trillion. The U.S. federal debt limit must be raised by August 2nd to prevent our nation from defaulting on its financial obligations. This has very serious implications for hospitals and healthcare across the nation. Here's why. Legislation to increase the debt limit will most likely include spending cuts. Because Medicare and Medicaid comprise nearly 23% of all federal spending, Democrats and Republicans agree that cuts in these programs are necessary. Our nation's hospitals will most likely face severe budget cuts as Congress works over the summer to address this issue. Pennsylvania's hospital community is preparing for a major advocacy campaign to tell our lawmakers that we oppose any further reductions in payments to hospital services under Medicare and Medicaid. In the coming weeks, Care for PA will keep you informed on this very important issue. These are very challenging times for Pennsylvania hospitals. On behalf of the hospitals throughout the state, thank you for your steadfast commitment to Pennsylvania's hospitals and the patients they care for.